Babies with COVID-19 tend to have mild illness. Study finds. To view the full article, click the first link in the description below. Infants under 3 months old who test positive for COVID-19 tend to do well, mostly showing only a fever and few respiratory symptoms, a new study reveals. The study, which included 18 infants, showed that out of the 50% who were admitted to a hospital's general inpatient service, none required oxygen, respiratory support, or intensive care. While there is limited data on infants with COVID-19 from the United States, our findings suggest that these babies mostly have mild illness and may not be at higher risk of severe disease as initially reported from China, said lead author Leena B. Mithal, pediatric infectious diseases expert from Lurie Childrens Hospitaland, assistant professor of pediatrics at Northwestern University Feinberg School of Medicine, in a statement. As COVID-19 cases spike in parts of the U.S., Apple to close down some stores again. Most of the infants in our study had fever, which suggests that for young infants being evaluated because of fever, COVID-19 may be an important cause, particularly in a region with widespread community activity. However, evaluation for bacterial infection in young infants with fever remains important, Mithal said. Out of the infants admitted to the hospital, 6 out of 9 had gastrointestinal symptoms, such as poor feeding, vomiting and diarrhea. Upper respiratory tract symptoms of cough and congestion preceded onset of GI symptoms, researchers said. Young infants also had notably high viral loads in their nasal specimens despite mild clinical illness. Asymptomatic COVID-19 patients have weaker immune response. China study finds it is unclear whether young infants with fever and a positive test for SARS-CoV-2 require hospital admission, explained Mithal. The decision to admit to the hospital is based on age, need for preemptive treatment of bacterial infection, clinical assessment, feeding tolerance, and adequacy of follow-up. There may be opportunities to utilize rapid SARS-CoV-2 testing. To view the full article, click the first link in the description below.